Well, thanks to advancements in treatment, people diagnosed with HIV have been able to live full lives for many years now, but not everybody has access to support and treatments to help manage the virus. It's one reason the Austin Area HIV Planning Council is holding a town hall tonight to get feedback on how to improve access.
And of course, joining us now to talk about it is Rashana Raggs with Austin Public Health. Rashana, thank you so much for being here.
Thank you.
We want to jump right in. We want to give people some context. How many people in the Austin area are living with HIV/AIDS? And is it on the rise? Have we seen a decline? What's the context there for us?
Currently at the moment, there are about 7,500 diagnosed people living with HIV in the Austin area. It is on the rise as more people are getting tested. They are getting diagnosed that they are living with HIV.
So according to the CDC, there are certain ethnicities that are disproportionately impacted by the virus. Can you tell us why that is?
Yes, sir. So you're going to see more disproportionate with the Black MSM. MSM stands for men who have sex with men, as well as the Latinx community. They are disproportionate due to the fact that the diversity of not being able to get that linkage to care that they need is what brings the the access to those resources down.
Now, I'm sorry, when you say the diversity, what are we talking about? They don't have access to certain...
They don't have access. There are certain barriers and needs that get skipped over, which is why we're having that Planning Council Town Hall tonight to hear from the community and hear back from them to see what can we do to help get that linkage to care and get them those access to those resources they need.
Gotcha.
Yeah.
Really important conversations. What are some of the other challenges that communities face regarding, barriers to care, also barriers to prevention and testing kind of before they're diagnosed?
One of the number one barriers is going to be stigma. Stigma in the community, the judgment, how HIV is looked on. And as you mentioned earlier, we are now in a place where people are living longer lives with HIV. People are getting tested more, which is great. So if we could lower that stigma and make sure that it's normalized to get tested, we could get more people to the care and access and resources they need.
Okay, so we're going to put the details up in just a moment with everything you need to know about the town hall, but tell us about what you're trying to achieve, who you would like to come, and what you want to hear from them.
We want the community to come. We want you to come. We want the providers to come. We want the people who are living with or impacted by HIV to come out. We want to hear back from everybody. We are literally utilizing this information to report this data back to show that Austin is making those changes and getting the people in the community the help that they need.
Okay, and she came with some amazing swag as well.
Right.
Tell us about what these are, why these are an important connection point for people at the event.
So these are our fanny packs. You can carry them around anywhere. Within them you will find a little bracelet which has a red ribbon. I'm wearing one myself right now. And also in that you will also find a card that is telling you how to join the Planning Council. We are always looking for new members, whether you are living with HIV or not. Please come join the Austin Planning Council. We would love to hear back from you. We would love for you to be on the council and help us continue to do this amazing work within the community.
Good stuff. Okay. That town hall meeting again is tonight from 6:30 to 8:30. It's at the City of Austin Permitting and Development Center building. That's on Wilhelmina Delco Drive in North Austin. Rashana, thank you so much for being here. Thanks for having this event and for giving people this invite to come out and hear what you guys have to say.
Yes, we hope that we can get as many people as possible so that we can hear back from everyone.
Absolutely.
Yes.
Thanks, Rashana.
Thank you.